We've seen some patients continue to improve for years, and some of them keep coming off shedding medications over years as well, where we're de-prescribing what they were on for their blood pressure.
My name's Dr. Jen Unwin. I'm a clinical health psychologist from the UK, and I specialise in helping people change their health-related behaviours and have the motivation to keep those changes going. And I'm also very interested in the whole topic of food addiction, sugar addiction, carb addiction.
Thank you. David?
Hello, I'm Dr. David Unwin. I'm a British general practitioner. I'm a Royal College of General Practitioner clinical expert in diabetes. Over the years, our practice has suffered a 10-fold increase in the number of people with type 2 diabetes. We can completely cure that in 93% of cases. But if you wait until you've got type 2 diabetes, I can only cure it in 73% of cases. If you wait another 5 years, we're down to 50%. I think the thing that really excites me is helping people become well but not use medication.
Jen, can you tell us what is sugar addiction and how does somebody know they're addicted to sugar?
Yeah, well, sugar addiction, or some people call it carbohydrate addiction or ultra-processed food addiction, is where somebody's lost control over their relationship with those foods. It's not a diagnosis, but it's an indication that maybe somebody's got some kind of a problem with their relationship with sugar or carbohydrate.
Do you have any practical tips or advice for getting used to wearing a CGM for somebody who's never worn one before?
Oh, I've got an embarrassing one. Shave your arm if you've got hairy arms, because it's murder pulling them off at the end of the 2 weeks. So plan ahead, shave.
Okay.
Okay?
Yeah, very good. We're all individuals, so the foods that you're eating, how's that impacting on your blood sugar? And that is fantastic information, because we don't really want to be having these spikes, because over time, those high blood sugars are damaging to the body and the brain and the bloodstream. So you just feel better and calmer in yourself if the blood sugars are steady during the day. So I'd say go ahead and have a go and see what you learn.
I think it's quite interesting to just put one on and don't change anything for a couple of days. Get an idea of what is normal for you and how you're living now, then start to make changes. So think carefully about why you're going to do this and what you're hoping for and what better looks like for you.
What is the relationship between what someone eats and their metabolic health? I'd love to hear from both of you.
Well, I mean, it's kind of simple at the end of the day that it's about glucose from, as I understand it anyway, as a psychologist. So it's about glucose, and obviously when we sugary foods, that's glucose, but also when we eat starchy foods and that digests down into glucose, the body just treats it in the same way. So if we're having high levels of sugary, starchy foods, then that's going to put our blood sugar up.
So the point is that a high blood sugar is actually dangerous for you. So when we were designed, we given the hormone insulin, and insulin does the vital job of getting a high blood sugar down. But here's the rub. Insulin brings blood sugar down by pushing that sugar out of the bloodstream and inside cells where it can do less damage. But if you continue to eat more sugar than you need to run around, then the sugar is driven into the cells where it becomes fat. And that's how it would become central obesity. So if I continue eating cake and cornflakes and biscuits, then I develop middle-age spread. But that's the sugar turned into fat on my belly.
We've talked about sugar and the foods that we're eating and how that impacts our glucose. How does wearing a CGM help somebody understand what's going on with their body?
It's immediate feedback, so it's there right in front of you. Like say you got up in the morning and you had your cereal and your orange juice, you'd see that visually, so you get the feedback on what's happening in your body. And that kind of immediate feedback is really helpful for people who want to change their behaviour, because you literally see what's happening right in front of them.
People become proud of their profile because it looks better, and they don't want to spoil it with a spike. So patients say to me, it's like having a policeman on your arm. I like to have it on because I know I'll spike if I eat biscuits, but I don't. It helps me eat better. So that's the feedback, but it also helps you maintain a healthier diet.
You've mentioned spikes a couple times, David. Can you just tell us what that is?
Yeah. Well, visually what's going on is we're looking at the blood sugar level. That's what the device is telling us, and you're seeing it as a graph. So it reads across, you see it going across, and a spike is where the blood sugar jumps up. And the question is, why did it just do that? Why did the blood sugar jump up? What did you just do?
Do you have a story of a patient that you've treated who's really benefited from wearing a CGM and seen really
I've got
strong?
loads.
Tell us a good one.
Ooh, yeah. So you're not diagnosed as having type 2 diabetes until you've had 2 blood results with a high result, okay? So I had a guy 7 years ago who had the first raised, and he never got the second one because I got to him. He used a device very briefly and learnt and didn't eat stuff that put his blood sugar up.
There's one lady, isn't there, that I remember, an older lady, and we prescribed her a CGM, and she just completely got back on track because she wanted to see the good blood sugars, and it was that accountability, and it was just her chance to sort of reset. So, yeah, we've seen that a few times, actually, people resetting like that.
And actually that same person was refused a hip replacement because she was overweight. So wearing the CGM enabled her to get her weight down, and then she successfully had the hip replacement. And some of these improvements can go on. We've been doing this for 12 years now. So we've seen some patients continue to improve for years, and some of them keep coming off shedding medications over years as well, where we're deprescribing what they were on for their blood pressure, what they were on for depression. And that is, it's very exciting medicine.